It's my great pleasure to welcome Dr. Beth Ebel to address a really important area of research and work around car seats and distracted driving. These are really hot topics in the field of injury prevention and injury control. And Dr. Ebel is the section lead for the Safe and Active Transport section here at the Injury Center. And she's a pediatrician, passionate about health disparities and translating research to practice and really making real world impact. And it's great to have her as a colleague, and I'm so excited that she's going to be able to share with you her thoughts and expertise in these areas.
Thank you, Dr. Ebel. Let's do it for her.
Thank you, everybody. It sounds like it's been a good morning, and I'm delighted to talk to you a little bit about the prevention side of brain injury. You heard a lot this morning about some of the treatment pieces, but we also need to continue to do work on preventing people from needing that treatment. So I'm going to talk to you a little bit today on seatbelts and more, on basically the new challenges and opportunities in helping people to get home safely. So as most of you know, we've always turned to motor vehicle crashes as this fantastic success story in public health, which it is. This is a model system for us on what it takes to make a change, a big change that's sustained over time. And this graph shows the incredible reduction in the motor vehicle death rates per vehicle mile traveled from the 1950s all the way to about 2013. But what I want to also talk to you today is that we are in a real new crisis in traffic safety, and we need to really bring all hands on deck to figure out what we can do to do better. Car crashes are, of course, one of the leading causes of traumatic brain injury. And in the past 2 years, we've seen a significant increase in fatal injuries and all injuries for traffic crashes. So last year, which is the newest data, it was the first time in over a decade that more than 40,000 people in the United States died in motor vehicle crashes in a single year. So we've really rolled back our fatal crash rates a decade. And the 2-year increase in traffic deaths in 2016 represents the largest increase that we've seen in the past 50 years. We've had a 14% increase in fatal injuries over that 2-year period. So why is that? This is data from the National Highway Traffic Safety Administration, and here you can see both the number of fatalities and the fatality rates per 100 million vehicle miles traveled. And one thing you can note here is this blue bar at the end is this big jump up in the number of fatal injuries. The number jumps even higher for 2016. And there's always some question as to how long do you watch to see if someone has died or not. But the latest data has this number over 40,000 people. And why is that? Well, if you look in Washington State, we've also seen the same thing. We've seen an increase in crash rates. Things tapered off around 2011, 2012. And as of 2013, we start to have this same increase in fatal car crashes and also in injuries in our state. This is the opposite of what we want to see happening. So why are we okay with this? This is so many people's lives, and all of us who work at the trauma center come back to prevention after seeing what we see on a daily basis for treatment. We see the hospital full of people whose injuries didn't need to happen, with known prevention strategies that were not used. And I think that's really, for me, my personal motivation for doing the work I do in research. And I think for all of us in the hospital, the majority of the crash injuries that we see have obvious prevention strategies that simply weren't implemented. So we should not be okay with this. We need to do better. So what are the preventable causes of traffic deaths? And you notice that I don't say traffic accidents. I'm talking about traffic deaths because accidents sound like something that just is inevitable, but collisions and crashes are purposeful public health issues, just like an infectious disease, just like treating traumatic brain injury, where there are whole toolbox of opportunities to do better. And these are the leading preventable causes of traffic deaths now. The first one to note is that people are driving more. And I put this as a preventable factor because that's a choice in how we structure things in our cities, in our rural areas. How do we want people to get around? And what I quoted you some data in terms of the crash rate for 100 million vehicle miles traveled. But when your traveling goes up, your crash rate goes up. Second, distracted driving. There's no question that the increase in crash rates mirrors this increasing use of devices in the car and the increasing use of more distracting technologies on those devices. This is something we need to address. It is a challenging problem. And again, we need to bring all hands on deck to fix it. Third, deaths outside the vehicle. And by this, I mean vulnerable road users. And this includes pedestrians and bicyclists. Ironically, we want people to be walking for other public health reasons, right? It's great for the person. It's great for our cities and growth. It's great for rural areas. There's very little that's better for you than your overall health than daily walking. We want people biking to work. We want people biking to school. We also need to put structures in place for that to be safe. And so we've seen a large increase in the deaths of folks hit by cars outside of the vehicle. Next, seatbelts. Seatbelts are tried and true. And the thing about seatbelts, and all of us who work in the trauma center see this, the seatbelt is the most powerful tool in the car for saving your life. Not only does it keep your body safe in a crash, but it keeps you in the spot that the car has planned for. It keeps you in the spot for the car to do its work around you so that all of the safety benefits of technology, your airbag, the crumple zones, the crash designs, the windows, the side impact air curtains, all of those things can go to work and save your life. So that seatbelt is critically important. And we really need to look at seatbelt use that approaches 100%. Because as you might guess, the folks who are least likely to use their seatbelts are the ones who are most likely to need them. And I'll talk a little bit about that. Impairment, still a leading cause of injury in traffic deaths, and there have been new things on the horizon for impairment. And last is vehicle speed. We've seen a rollback of speed limits in our country and an increase in high-speed crashes, and we pay the price on that. The injury transfer of energy to the person comes as the speed squared. So when your speed doubles from 20 to 40 miles an hour, your injury rate is going to go up fourfold, and your body really can't sustain that speed. Behind those causes are another set of preventable causes, and these really have to do with the policy framework under which we make our decisions about keeping people safe. And we all need to work at this. We can not only work in the hospitals or in the clinics as physicians and as public health people, because the real gains and advances happen at this level. It is infrastructure for safe streets and traveling safety, the social environment, laws, and technology under which we operate for traffic safety. Economic factors are very important. I mean, it really matters what the price of gas is. It really matters the cost of other safety measures, price of alcohol. All of these things factor into decisions that consumers make. We've also seen more lenient enforcement of seatbelt, impaired driving, and speed laws. And then in some states, and not all, there's been some great success stories, but a reluctance by some lawmakers to pass more restrictive traffic safety laws or roll back laws. And the consequences for that get paid in the lives of people coming into the trauma center. So this kind of bad news after 50 years of better news. So why are crash rates rising? Well, this graph is for the 2014 to 2016. And I've separated out here the increase in fatalities because at this time, detailed data on the causes of crash was available only through the first part of 2016 at this point. So I've looked at just compared the first 6 months of 2014, 15, and 16 to get this graph. And what you see is this green portion is the increase in crash rates in vehicle miles. So again, let's not neglect this. These are people choosing to get in a car and drive more as opposed to the other ways that you can get around. And that has contributed very substantially to traffic deaths. You see this big blue portion is the increase in other risk factors. That's about 2/3 of the burden. And so both of these factors play a role in the increase in traffic deaths, and we can address both of them through public health approaches. So let's look at those crash risk factors over from the 2014 to 15 period. You can see that the vehicle mile travel increase was responsible for almost 4%, a little over 3% of the increase in traffic fatalities. And then you can see the other factors that mattered. This is alcohol impaired driving, responsible for about the same, about a 3% increase. Passenger car deaths went up though. Pickup car deaths went up, van deaths went up. You see this 8% increase in motorcycle fatal injuries. And then you see here, pedestrian and bicyclists approaching 10% and 12% increases over this 1 year period in their contribution to fatal traffic deaths. Very, very concerning when we know that those are things that we're encouraging for kids and for all of us. So when you look at that, and this data reiterates that slide and shows that the overall fatal increase or risk over that time period was a 7% increase. So what does that look like? This is a pie graph that kind of shows you in 2016, we had people in cars here, passenger cars and light trucks, and then this small portion of large trucks. Here's our motorcycle group and our pedestrians, bicyclists. And again, you see this increase here in both the motorcycle and the pedestrian piece, which is squeezing out the other traffic fatalities. And again, there's some benefits to our society and our wellness for some of this, certainly the active transport portion. But then you can see that there's increased risk as well. And some of that is in the context of those other factors such as distraction, speed, and impairment that I mentioned before. So who is being impacted by this risk on the roads? The biggest group here are drivers who are young drivers. So again, for those of us who are pediatricians, this is an area that we cannot neglect. Young drivers are learning to drive. They have cognitive loads in that process of learning, and they're negotiating this complicated environment. At the same time, we have new technological pressures for them, and the upshot is a 12.4% increase in fatal injuries for our teenagers over that time period. And again, you see this 10.3% increase for the next group up, this 25 to 44-year-olds. Here are our young 15 to 20-year-old drivers, and then older drivers as well, with this increase even above the 7.2% increase that happened over that time period. So very, very concerning, but you can see that there was an increase across the board in all of these age groups. This graph just makes the point here about the death rates for folks inside vehicles as occupants and outside vehicles as cyclists, pedestrians, and bicyclists. And you can see here that our inside folks have had a decrease in their, these fatality rates have decreased here relative to what we see with the folks outside the vehicle. And when you start to think about those people outside the vehicle, again, you have to step back and start thinking about what is the systems approach that you're going to take to tackling this problem. So what are the behaviors that we can modify that underlie this traffic risk? Well, number one right here is we've done some work on this, but this is a very challenging problem. These are distraction-affected fatalities. And this number here showed an 8.8% increase in fatalities over this 1 year time period. And realizing the fact that distraction is still poorly measured by police officers, it's poorly measured in a crash. People are not forthcoming in reporting their cell phone use. So this is likely an underrepresentation of the actual risk for distracted driving. We also have unrestrained passenger vehicle occupant fatalities where there's been an increase. And that's despite all that we know about seatbelt use and the amazing work that has been done state by state, county by county to promote and move towards target zero and increase seatbelt use. So we have reached the place we are in seatbelt use and we should be proud of it. by hard work, but you don't get there and find that you're on a happy plateau. You get there and you find out that you are there through your hard work on an inclined face, and you're not going to stay there without a consistent push of resources, education, and particularly enforcement to be able to stay there and save lives due to the higher use of seatbelts. We've seen an increase in alcohol impaired driving fatalities, again, despite the public health gains that we've had in this area over time, and a 3% increase in speed-related fatalities. I'll talk about all these in my talk. And then there was a diminution of drowsy driving. So I guess we could celebrate that one piece and drink another cup of coffee. So let's go over some of these factors. So first I'm going to talk about seatbelt use and restraint use. It's interesting to me because I've been super proud of our state in Washington as we have been really moved from when I started my work here at the Injury Center, about 83% seatbelt use, to where we find ourselves now, which is in the mid to high 90% seatbelt use. I mean, it's fantastic. And I can tell you that on a day-to-day basis, when you go to the trauma center, you see the impact of the seatbelt use law that we have, our primary enforcement law, and the use of seatbelts in every single day in how people are not injured. You see folks in the emergency department in terrible crashes who have their seatbelt on and they get to go home. And so that is a beautiful thing. And just all of us who work there become very passionate about seatbelt use. So it might be surprising to say that today, now, I mean, as of 2015, when you look at fatally injured passengers, even though our national seatbelt use is up in the 80s, the mid to high 80s, almost half of all fatally injured people weren't wearing a seatbelt at all. Not at all. And that's true for kids and adults. So this aspect of having nothing, no seatbelt at all, is an area where we need to really push. We need to push for everyone. We need to push on enforcement, and then we need to push community by community to improve our restraint use. Seatbelt use for those people who survive a crash is about 86%. So you really see a difference. It's an incredible protective factor. And what can we do to improve seatbelt use for adults? And I'm also going to talk for a minute about car seat use for kids. Well, for seatbelt use for adults, again, to me, it's surprising that for something that kills 40,000 Americans a year, that only 18 out of our states have primary enforcement seatbelt laws. Most of you know what that is, but what it means is that a police officer can pull you over and give you a citation simply for not having your seatbelt on. And when I say simply, I think there's a perception in some places that this is sort of a nuisance because I wasn't, up to any problem. But the reality is that those seatbelt, that primary enforcement buys you, 10, 12 percentage points in seatbelt use. And the people who are going and buckling up because of the enforcement are the folks who most need that belt. Okay, those are the folks who are at highest crash risk. They may live in areas where the driving environment is less safe. And so there's incredible incentive for communities to really put their heads together and say, we can make incredible progress here, but one of the pieces for that is a legislative approach combined with the enforcement efforts. Passing a law, of course, doesn't make the law work, just like you can order something, but it needs to actually show up. So the seatbelt laws work only as well as the enforcement works. And that means we need law enforcement officers who are willing to enforce these laws. They need to be supported to do so. And that's a challenge. Law enforcement folks tell you that they went into law enforcement to get the bad guy. And they don't consider oftentimes the unbuckled motorist as someone who's really putting other people at risk. But they're putting themselves at risk. They put other drivers at risk. They put other occupants in their vehicle at risk. And so this does require some work to educate and incentivize enforcement of the seatbelt laws. Another option that is known to work is photo enforcement. And photo enforcement doesn't require a lot of time and effort from personnel time, and it can be highly effective. Here's an example. I've got an example in a minute that I'll show you from our place here where we set up photo enforcement in school zones, and you can sort of see the impact on drivers. Let's talk for a minute too about kids and car seats. The car seat use rates, we've had, again, technological improvements. I'm showing you this puppy here, which is Darling, but in fact, New Jersey is really leading the fact they actually have a law requiring your pet to be buckled. But in so many places, we don't even require anybody in the back seat to have a seatbelt on at all. In so many states, we don't require that kids are appropriately buckled. And so for kids in their car seats, what we've learned is that the safest seatbelt use options for you, the highest restraint use, like being buckled in a 5-point restraint like this puppy is safer for you than graduating to the next booster seat stage, as long as you meet the manufacturer's requirements for that restraint use. But again, how does this happen? Part of this does happen through the passage of laws. And I'll give you an example. I know in Washington State this year, we had a law that was getting considered to try to update our state laws to match the recommendations from the public health and the pediatric community in a couple key areas. The first is rear-facing tilt 2. And again, it sounds funny, there's not a lot of tickets written for car seat use. In the whole country there aren't, and there certainly aren't in Washington State. And yet passing those laws is the impetus for doing some important education for families. One of the things that's always striking to me, and I think somewhat gratifying, is that parents and people who have a lot of skepticism about politics these days have confidence, sometimes misplaced confidence, that politicians and laws are passed when something is safer. So laws that are passed to say, look, you have to have your kid in a rear-facing seat tilt 2 sends the message that that is now an incredible safety benefit for infants, which is true. When you have a big pumpkin head on a little tiny stalk, and the most serious crashes are crashes from the front of your vehicle, then rear-facing seats keep that brain, that beautiful pumpkin, protected by diffusing the force of that crash all along the back of that car seat. This is why astronauts landed in the ocean going backwards. It's incredibly efficient strategy for distributing the force, and kids need that because physiologically they're bobbleheads. So passing laws and updating laws that help to support the educational messages that we have is a critical piece, I think, of helping parents to be able to come to their kids and say, hey, honey, you've got to be in this seat because that's what the law is. It's also helpful for manufacturers and communities to say, look, let's get car seats that accommodate the bigger kids that we see these days. So that's a critical piece, and really trying to keep kids rear-facing tilt 2 is one critical piece of how we can do better for children. The next is to reduce that early transition out of the car seat. And we know that booster seats are important. They're critically important for making sure that the seatbelt fits a child properly when they've grown out of the harness type seats. But many kids are in that booster seat a very short period of time, and then they transition into the adult seatbelt. So that's another place where we really need to do better. Many of those kids, by the time they hit elementary school, are just coming into the adult seatbelt. But for Dr. Babalala, Dr. Ibarra, and myself, who work in the trauma center, we see 10 and 11-year-old kids with these serious lap belt injuries because their kid was not in the appropriate booster seat. And they don't actually fit into the car seats. So that is a critical piece, getting that booster seat use and having families appreciate that booster seat use is required until you're about 4'9". For most kids, that's about 10. Again, state laws can work to support this better. And I will mention here, and I'm scattered throughout my presentation, that we do better when we can target our messages to specific communities too. There needs to be specific outreach for Spanish-speaking families who have not gotten the education that they need to learn about the new laws here if they're coming from other places. We need to do specific outreach to Native American communities. We need to do specific outreach to other communities of color, and work here in every community if we're going to do better on car seat and seatbelt use. Let me talk for a minute about folks who are now out of their booster seats and into the driver's seat, and show you some data from Australia to focus a bit on our young drivers. For all occupants, this is the highest risk. This is absolutely the highest risk for kids. And what you see is when kids are in the learning period, this first year, their driving risk, because the parent is in the car, their driving crash risk is your crash risk as a parent. It's incredibly protective to have an adult in the car as that kid is learning, even though they're a terrible driver, probably. But once the parent comes out of the car, they move into this probationary driving period. You see this incredible crash risk that starts to diminish over 6 months to a year, but continues to be an elevated crash risk, really, while people gain the experience they need to be a competent driver. And so we really need to continue to work on ways to improve the learning here in this learning cycle, possibly extending the learning period of supervised driving time, perhaps allowing permits earlier as they do in some countries, and then allowing a longer period of time for learners to get that supervised training. And then we need to continue to push for strategies to keep kids safe through this probationary period, and maybe to extend it to this little bit older drivers. We see a lot of crashes of injuries and fatalities in our state and across the country in this high risk group of kids who are managing a new learning behavior at the same time as they have to deal with cell phones, higher use of impaired driving, substances, and general risk-taking behaviors. So let's transition to a minute to impaired driving. Impaired driving remains a critical problem for our country. There has been a rise in alcohol-related crashes. Here's one picture of that. We also have seen a rise in drug driving and the commingling of substance use. So alcohol plus marijuana, alcohol plus pain medication use. At the same time, there's been a pushback in many states, including ours, with legal challenges to the collection of blood evidence. And on the ground, what this means is that a police officer has to phone into her office or get a warrant in the middle of the night before blood evidence and sometimes even breathalyzer evidence can be collected. So this has just raised one more barrier for law enforcement officers to feel like, gosh, I got to get, going to spend here for 4 hours trying to get a warrant and get this person brought in, even though I know this is an impaired driver. And there's a debate about whether when you're a driver, your license comes with what's been called implied consent. That means you have implied, when we give you a license, it's a privilege, and we say that you get this privilege under the condition that you will not be an impaired driver, and therefore you've given your implied consent for these data collection concerns if there's concern about your impairment, versus other laws that are there to withhold, to protect people against unreasonable search and seizure. And this is a discussion that needs to be sorted out. There are options for this if the decision is made, as it is right now in our state, that a warrant is needed for blood evidence. There is opportunity to improve reasonable search and seizure. We also need to tackle the marijuana and the drug driving challenges that we face. So, drivers in fatal crashes, what else do we know? Nationwide, only 57% of fatally injured drivers were tested for drugs. So that's really opportunity for us to do better. And we need to know what's going on for drivers before we can figure out how to address those problems. We talk a little bit about speeding. We've seen many states roll back their speeding laws to the point that in some communities and rural communities, the speed limit has gone up to 85 miles an hour. So to tackle speeding, speeding is energy transfer and it's crash severity. So we need to address the laws, enforcement, and technology, and start to push back against the legal framework that's allowing these really high speeds that put people at risk. This is the example I mentioned to you before. Photo enforcement, which is an option. This is the work that Alex Quisper did. And you can see around school zones that once photo enforcement starts, the violation rates come down dramatically. And it's almost kind of interesting that after a break, like here's after a Christmas break, we had to the rates come up again, and then people figure it out. And after summer break, citation rates come up again and people figure it out. So this photo enforcement really transforms people's driving behavior and is sometimes a low cost and effective way to take care of speed. We need to consider protection for high risk travelers like motorcycles, which helmet rates work great. but only 19 states and DC mandate helmet use for riders. Here's an example of the testimony in Washington State, and there's like a room full of people, and I think 2 public health folks testifying in favor of the motorcycle law. So bicycle safety, I'm going to skip over, and I'm going to talk for 1 minute about distraction and then make sure we have time for questions. Distracted driving is, as you know, something we've been working on here, but it is a problem for everyone, walkers and drivers, and very, very challenging to change this risky behavior. Drivers already know this is a problem, but they do it anyway. So what works? Well, we can do some education and enforcement. It really is effective, but we need to also pass the laws that support effective enforcement. And one incredible success that we've had this year is the distracted driving law, and I'm happy to talk about that. And I'll just end by saying that I mentioned to you that a lot of these data come from vehicle miles per, vehicle miles traveled, but we can reduce the time you spend in a car and also keep you safe. These are really rethinking transportation and safe streets. There are options for doing this and doing it safely so people can get to where they want to go, but it requires infrastructure, investment, and public commitment. And we're starting to see creative models there in other places. So thank you for your time. I know this is a big slice of injury prevention. I'm happy to take questions about any of the aspects that I've covered, and I'll make my slides available for questions later. All right, so someone's got to help me figure out how to get the questions at the bottom.
Actually, hover over the top.
Ah, there we go. Okay, thank you. Okay, so a participant from Tennessee says, Project Brain is participating today from across the state and sharing this with our friends, and is interested to share their work of what they're doing for TBI. Here's a question from Teresa. What is law enforcement doing to increase the seatbelt enforcement? And who's leading that effort in Washington State? Insurance incentives should be given and advertised. Can we use our billboards and signs effective? I think in our state, the biggest focus has been on target zero. And I think one of the challenges we face is that once we have reached fairly high seatbelt levels, but as I said, there's a need to continue that investment in enforcement to maintain that enforcement, to maintain those seatbelt levels. So the road signs work only in conjunction with law enforcement showing up visibly and doing the job. And the data really has shown that when you see somebody out there pulled over, the driver who doesn't think that she's susceptible to crashing does think she's liable for getting a ticket for the seatbelt. And even impaired people do the same. So that enforcement piece is both that primary enforcement law, which is, I think, critical, and then the working on the ground with police offices to appreciate that seatbelt enforcement times like target zero and sometimes incentives for doing that are critically important to saving people's lives, just like catching the bad guy. Jennifer Raymond asks, if a child's size falls within the car seat's specified standard, is rear facing still best as long as possible after 2? And the answer is absolutely yes. For the reasons I mentioned, those front crashes are the most fatal crashes. That rear facing car seat offers substantial protection. Data from Europe should suggest that rear facing till 4 offers you a safety benefit. And that's why the American Academy of Pediatrics changed their standards. And there's a question about recreational marijuana laws and the significant effect towards traffic crashes. This is an area that we still need to study. And as I mentioned, we have challenges in the collection of good data around crash marijuana use. A lot of times there are urine tests that are done which don't measure acute intoxication, and we still don't have an effective breathalyzer test for marijuana, as an example. But I'd say the concerning part is the incredible rise in marijuana use among impaired drivers. There's been a big increase in our state and in the country in general. On the flip side, there have been several studies, case control studies, that show that marijuana versus alcohol for crash rate, alcohol is still hands down the most dangerous substance. So we have to continue to keep that at the forefront. But we're starting to see this layering on of alcohol and marijuana, where you're you know, it's not, I think the marijuana industry would like to say, oh, this is safer. There is a lot of data that people are both drinking and getting high. And that combination is leading to significant impairment. So they influence things in different ways. And it's a big challenge. Robert Olmsted is asking, is blood alcohol testing, or blood testing, I think, well, blood, I think the question is blood alcohol, is breathalyzer testing coming for marijuana? I would say for states that they need to consider two things. The first, I'm going to say three things. The first is that just because somebody has alcohol in the system, you need to do the blood test for other drugs of abuse, because you'll find them and they contribute. So in our state, we finally have now moved to that place where for our state labs, when you come in and you're being tested for impairment, you will be tested for all substances. But that wasn't the case before, and we got significant undercounting about the contribution of drugs. For breathalyzer testing for marijuana, there are people very interested in this. There's studies going on for it. There's not an industry standard test that is going to hold up in court right now. So blood alcohol testing is needed. And then the third piece there is we need to make sure that that can happen quickly. The median time of metabolism for active marijuana in the blood is about an hour. So, you know, for somebody out there who's, you know, high, they have a lot of incentive to stall. And if part of that stall requires getting a warrant, and that process takes a long time, and then somebody doesn't have the skills to draw your blood, that process takes a long time. Boy, by the time you slowly drag your feet into the, you know, some place where your blood can be drawn, wow, what a surprise, you're not, your marijuana levels are lower, even though you were clearly impaired at the scene. Now, many judges will still uphold impairment based on field sobriety and your driving behavior, but we need to do better at that point of contact with the officer to find out what sort of impairment is going on. Our state, for instance, just passed a law to train some of our officers to be phlebotomists so that they can take that blood at the time, and that'll be critical. And some of our communities have also have innovative programs where they have just-in-time warrant, where there's a judge who's designated to be kind of that nighttime contact to authorize a warrant when there's concern for impairment. And that is really making a difference as well. So we've been really used technology to work for us on trying to get more timely collection of blood alcohol testing that's going to hold up at the point of contact. That allows us to start to put some of the things that we know work on the treatment side, which includes alcohol treatment, works great, brief alcohol interventions, which are highly effective, ignition interlocks, and some of the other good work that's going on for chronic alcohol abusers that really can help them and the people around them stay safe. Let's see, are there other questions that I can see here?
There's one question in the chat box.
In the chat box, okay. So my own technology here. Chat box, view options. Somebody might,
The question is about current guidelines and how long it is and how they should remain rear-facing.
Oh, okay, great. So current guidelines, the current guidelines in our country are rear-facing till at least 2, but until you're safest to stay rear-facing until you've outgrown the seat weight and size requirements, mostly the weight requirements. So for small kids, they're going to be safest facing rear until they outgrow that car seat. And what we're really pushing for in our primary care is that your first seat, instead of those little carriers, your very first seat is one of these convertible seats that'll serve you rear facing in the car until you grow out of it, and then can be turned forward facing. So you get to use that seat for a good long time. All right, and then let's see. I think that question about rear facing has been there. So the trouble for many of us is that the state laws don't support the public health recommendations at the current time. So I think this is something for our public health community to start to work and educate lawmakers about as we move forward, because really they have that opportunity to speak volumes to our policy folks on why this matters. Well, thank you. I think we're at the end of the question time, and I really appreciate everybody's time and look forward to hearing from folks about the seminar moving forward. But thanks for all the work you do in the trenches, because you're the folks who really make public health happen.
Thank you so much, Dr. Ebel, and we will be transitioning here, and we'll be reconvening in about 5 minutes.
Great.
So let's, when you go to talk to Carol, you need to get